I usually do Friday by noon. Don't want to be bugged. Get in your time next week when you're off. That makes sense. Reminder.
Good plan.
Chris, good morning or afternoon, depending on where you are joining from. My name is Nicholas Lewis. I'm the Vice Chairperson on the National Indian Health Board and the Portland Area Representative. It is my pleasure to welcome you to the 2021 National Health Conference Centers for Medicare and Medicaid Services listening session. Before we begin, please note that this session is being recorded. And if you do not consent to being recorded during this session, you are asked to drop off this session at this time. And I'll give just a brief few moments for anyone that wishes to drop off to drop off. As it is customary, we will start this meeting in a good way with an opening prayer. I know that while we're all here from across our country, we all have different faiths and beliefs, but one thing as Native people, we believe in our Creator. I'd like to take a moment and ask the Creator to watch over each and every one of us, watch over our loved ones, watch over our people, watch over our communities, watch over our elders, especially and our youth who are the future. I ask that you watch over all those that are struggling, whether it's from homelessness or mental health. I ask that you watch over those that are struggling with addiction and help give them hope and light to return home to their loved ones in these times. We ask that you watch over all of the work that we're doing here on behalf of our people and help us get back to the life that we miss and cherish, where we can enjoy one another's company, travel and visit with one another. We say this in your name, amen. During this session, we'll be speaking with some leadership at CMS. Kitty Marks, who is the Director of Tribal Affairs, Dr. Susan Carroll, who's the Chief Medical Officer for the Division of Tribal Affairs, Lane Twilliger, Division of Tribal Affairs, Rachel Ryan Peterson, Health Insurance Specialist, Division of Tribal Affairs, and Cindy Gillespie, Technical Director for CMS Medicaid and CHIP Operations Group. We appreciate the engagement with Mrs. Marks and her leadership team, and we'll look forward to discussing a host of issues that are important to our tribal nations. We also appreciate President Biden's renewed commitment to strengthening tribal consultation and government-to-government relationships. We further commend CMS for taking the steps to engage with tribal leaders as they review their policies. We are excited to engage with CMS on this critical topic, and we look forward to the fruitful discussion ahead. As tribal leaders, we appreciate the time we have with CMS so that we can share our guidance and recommendations. This is a dynamic time, and we want to ensure that the tribal leader perspectives and voices of our people are heard, understood, and incorporated in the agency's work. To start us off today, Director Marks and her team will share some additional information on the Tribal Consultation Policy. After that, we will open our discussion portion of the meeting. Like other listening sessions, we will follow tribal protocol and invite our elected tribals to make comments, share recommendations, and ask questions first. Once our tribal leaders have had the chance to speak, we will open the floor to other members of the audience. And now to provide us with opening remarks, it is my pleasure to introduce Kitty Marks. Kitty Marks is the Director of Division of Tribal Affairs in the Centers for Medicaid and CHIP Services at CMS. The CMS Division of Tribal Affairs serves as the point of contact on Indian health issues for the agency and for tribal leaders Indian health providers, and beneficiaries. Prior to CMS, Kitty served as the legislative director for the National Indian Health Board. She has also worked for Indian Health Services and for Montana Legal Services in Browning, Montana. Kitty received a Bachelor of Arts from the University of Maryland and his Juris Doctor degree from Vermont Law School. Director Marks, it is good to have you with us and others to speak with each and every one of us. Thank you for taking the time to be with us for this important meeting. I will now turn the floor over to you and your team.
Okay, thank you very much, Chairman Lewis, for that warm welcome. We have a PowerPoint slide presentation about our CMS Tribal Consultation Policy. So we're going to start off with that, and then we can open up the call for any questions you might have. But we are starting to reevaluate our tribal consultation policy. So we wanted to take this opportunity to provide an overview, and this will kickstart our efforts to improve our tribal consultation policy. So next slide, please. So this is a favorite slide of ours. It's very colorful, but I wanted just to let you know that we work, and I think many of you do know this, that we work in collaboration with Native American contacts. And through a reorganization back in 2019, we were able to establish 4 full-time Medicaid Native American contacts, and we were able to assign them to IHS area designations. So this is a map that HHS IEA Tribal Affairs provided to us, and you can see where the HHS regions lie on top of the IHS areas. So Cindy Gillespie, who is the technical director in the Medicaid and CHIP operations group, kind of oversees the NACs, and we work very closely with Cindy and the others in MCOG. And so let me just go through the Native American contacts who I believe are on the line to listen to any issues that you might raise today. So Nancy Grano is the NAC for Nashville and Bemidji areas. Stacy Schumann Steiner, she just recently got married. Stacy Steiner is the NAC for Albuquerque, Oklahoma, and Great Plains areas. Cindy Lamesh is the NAC for California, Navajo, Phoenix, and Tucson. And Justina Redlinsky is the NAC for the Alaska, Portland, and Billings area. And then, of course, Mary Munoz continues to serve as a NAC and help us with Medicare issues. And Dorsey Sagoni helps us with survey and certification issues. So please feel free to contact your NACs on any issues that you might have, whether they be Medicaid or survey and cert. They do serve as the point of contacts for you in the areas. And if we can't answer the question directly, we'll be able to get assistance to you. So next slide, please. So as Chairman Lewis referenced, President Biden issued a White House memorandum on tribal consultation, reaffirming the government-to-government relationship between tribes and the federal government. And CMS recognizes that there is a unique government-to-government relationship that exists, and it's based on the US Constitution, treaties, federal statutes, federal case law, and executive orders. And so pursuant to the President's White House memorandum, CMS will be reevaluating its tribal consultation policy. The last time we reevaluated was back in 2015. So it's due for a good review. We will be issuing a Dear Tribal Leader letter seeking comments. We will also be holding an all tribes call to hear comments and answer any questions. And then we'll be working closely with the CMS TTAG Tribal Consultation Subcommittee. And Ron Allen is the chair of the CMS TTAG, and he is the chair of the Tribal Consultation Subcommittee. And unfortunately, he was planning on being on today's call, but had an emergency. So we will be working on reevaluating the policy, issuing the Dear Tribal Leader letter in the very near future, and then working through 2022 to evaluate comments received. Next slide, please. So it was in 2011 that CMS issued its first tribal consultation policy. And the policy was developed over several years, I think for about 10 years. The TTAG and others worked on the tribal consultation policy, but we were able to get it signed by then Administrator Berwick in 2011. And then in 2015, we revised our policy, and this is a link where you can find a copy of our policy. Next slide, please. And in our policy, we explain that the purpose is to further the government-to-government relationship between CMS and the tribes, to build meaningful relationships, and also, more importantly, to establish a clear, concise, and mutually acceptable process for consultation between CMS and tribes. Next slide, please. And we recognize that it's important for CMS to have open and continuous consultation. We know that the involvement of tribes is critical in developing CMS policy. We know that CMS policies, whether it be regulations or other guidance, has a tremendous impact on the Indian healthcare providers, but also to American Indians and Alaska Natives who enroll in the CMS programs, whether it be Medicare, Medicaid, and CHIP in the marketplace. And consultation is triggered when there's an action that will significantly affect Indian tribes. And in our policy, we explain that that is determined on a case-by-case basis. Next slide, please. And then within CMS, our office does serve as the point of contact to ensure the agency is in compliance with its policy. We serve as a resource to assist our components within CMS, but also state Medicaid agencies in determining whether a policy or regulation could have a significant effect on tribes. And then we work with the CMS TTAG in identifying key issues that might require tribal engagement and or consultation. Next slide, please. And so this is all spelled out in our policy, but this is the guideline that we use to determine whether consultation is required. First, we have to determine, what the program is, what the policy underlying statute might be. We have to understand what the tribal implications are and whether that policy that's under development or has been issued will have a direct effect on one or more tribes. And then we identify whether it's several tribes or maybe just perhaps one tribe. So next slide, please. And once we identify that consultation is required, we evaluate the nature of the event and its impact on tribes to determine the best way to conduct tribal consultation. There have been occasions when CMS has issued a Dear Tribal Leader letter. We hold all tribes calls on a pretty regular basis, especially when we have proposed regulations that are under development or have been published to obtain tribal input. Of course, CMS participates in the HHS national and regional consultations, including the tribal budget consultation sessions. And then we are available to organize tribal consultation conference calls as needed. And because CMS is a regulatory agency, we do rely on the public comment process through the Federal Register. It's really critical for tribes, tribal organizations, health directors to comment on regulations that are published and to flag for the agency and those components that are working on those regulations what the tribal impact could be. Our office does review Federal Register notices as they go through, and we flag those as having tribal implications as well, but we don't always catch the issues. And so that's why it's important for tribes and like I said, Indian healthcare providers to review regulations and working through the TTAG and the NIHB, we provide additional technical assistance on that process as well. So next slide, please. And then as part of our policy, we do require that we assess the policy to determine its effectiveness. Like I said, back in 2015 was the last time we revised or even assessed our policy. We issued a Dear Tribal Leader letter in 2014. And again, we held an all tribes call. We also reached out to state Medicaid directors to receive their feedback and ideas about the state tribal consultation policy. So next slide, please. As part of that work that we did in 2014, we evaluated the comments that we received. We worked through the Tribal Consultation Policy Subcommittee to review the comments. We tracked the comments. And then we did work in collaboration with the TTAG and state Medicaid staff to develop the final policy for agency clearance. And then it was approved by the TTAG and signed by Administrator Andy Slavic at the time on December 10th, 2015. So next slide, please. One of the critical elements that we heard from tribes when we evaluated the policy back in 2014, 2015 was to create a new section of the policy incorporating all the state tribal consultation requirements into the policy itself. This includes the tribal consultation requirements required under Section 5006 of the American Reinvestment and Recovery Act, transparency regulations requiring the agency to obtain tribal consultation on 1115 demonstrations, and an older 2001 state Medicaid director letter that had been issued. So what we did, we put all of these requirements into Section 8. We also explained the requirements that for the states to obtain advice and input from Indian healthcare providers and tribes prior to making any changes to its state Medicaid program. And it also includes a process for the agency's review of any SPAs or waivers that come in for CMS approval. So why don't we go to the next slide, please? So what we do at CMS when there is a waiver or SPA that has been submitted by the state for approval, we make sure that the state has followed its state tribal consultation requirement. That's the first thing that the CMS state leads and NACs working together, they make that determination. If it is determined that consultation did not occur, then we deem the waiver or the SPA incomplete and we return it to the state for tribal consultation. The CMS Tribal Consultation Policy also explains that during the review of the state plan amendment or waiver, as we review it, we may not be able to prove what the state actually proposed. But if that happens, so that the proposal that we are able to approve is different from what the state had consulted the tribes on, then we either request the state to go back and initiate another consultation, or we consult directly with the tribes impacted. The Section 8 also explains that at any time during the waiver or state plan amendment approval process, a tribe may invoke consultation directly with CMS prior to a final decision, whether to approve the waiver or the state plan. And we do encourage tribes to complete its consultations with the state before requesting consultation with CMS, as the state might agree with the tribes and no consultation would be needed by CMS. But it is important to remember that that ability of tribes to invoke consultation with CMS remains, and it has been successful over the years. So next slide, please. So this is a chart that just explains the different state tribal consultation requirements. We have the requirements under the American Reinvestment and Recovery Act, ARRA, which was codified in law, and it requires states to obtain the advice and input from Indian healthcare providers. That means IHS, tribal providers, and urban Indian organizations on any Medicaid and CHIP state plan amendments, new 1115 Medicaid demonstrations, including extensions and amendments, and any 1915 waiver applications, extensions, and amendments. Then the transparency regulations apply for the review of new Medicaid 1115 demonstrations and extensions. And that's a requirement for states to consult with tribes in their states prior to submission of these 1115 applications. Many state tribal consultation plans include a process to obtain advice and input from Indian healthcare providers and federally recognized tribes. But they don't have to. And so that's when the 2001 state Medicaid director letter kicks in, that a state tribal consultation SPA does not include a federally recognized tribes. And so they can use that process. So next slide, please. So the ARRA provision has been very important. It does require advice and input, like I said, from IHS tribes and UIOs. And the state had to submit a process on how they were going to obtain this advice. And states have submitted tribal consultation state plan amendments where they spell out how they are going to obtain the advice and input from ITUs, and if at their option, they can include federally recognized tribes in that process. And so those state tribal consultation plans had to be developed in consultation with tribes and with ITUs, and they were submitted to CMS for approval back in 2010, 2011. Occasionally they are modified, again, of course, with consultation with the tribes and ITUs in their state. Next slide, please. There are 37 approved tribal consultation SPAs, and these can be found on our American Indian Alaska Native website. You can download them. If you don't have the tribal consultation SPA handy, you can find those on our American Indian Alaska Native website at go.cms.gov/AIAN. So next slide, please. And I just wanted to highlight some examples of tribal consultation that we have done over the years. Back in 2010, we issued a state Medicaid director letter implementing all the various provisions in 5006 of ARRA. We consulted with tribes in the development of a state health official letter where we extended the 100% federal medical assistance percentage for services received through IHS and tribal facilities. In that particular case, we went out for a request for comment that was posted on our website, and we held a national all tribes call. We held an all tribes call with, Lane, can you put your video on mute, please? I'm sorry. Yeah, thank you. Good. And we also held specific state all tribes calls with the state of Alaska and South Dakota, who were interested in expanding the 100% FMAP for services received through IHS and tribal facilities. We've held tribal consultation on various Medicare regulations, such as the Medicare Diabetes Prevention Program. And we will be hosting an all tribes call on the new rural emergency hospital provider type on October 21st. And you'll hear more about that later today. And then the provision in Section 8 where tribes can invoke consultation directly with CMS, we saw that option exercised in 2017 and 2018 after we issued a state Medicaid director letter allowing states to require community and work requirements as a condition of Medicaid. We heard from tribes who were very concerned with that proposal from states, but we have held consultation directly with tribes on other larger demonstration proposals as well. So I think that's it for my slides. Why don't you go to the next slide? This is our Tribal Affairs mailbox that we maintain, and you can always send questions to this mailbox, tribalaffairs@cms.hhs.gov. So Chairman Lewis, we can go ahead and open it up for any questions or comments.
Okay, thank you very much, Kitty, for those updates. Those are all important information that you shared. And now we will go ahead and start our discussion portion of the meeting. And our National Indian Health Board of Directors have a few questions to start us off with. And I would like to invite my fellow board member and chair of the National Indian Health Board, Chief Smith, to ask the first question. Chief Smith, are you there? AC, or
I'm looking for him. I don't see him. In the... Chief Smith, are you here?
he messaged and said he was on. And while you're
There he
looking
is.
that up,
Here.
okay.
Here he is. Chief Smith? Chief. One second. It looks like we're having some. Chief Smith, are you there?
In the world of
Hey,
Zoom, it
we
could
can
be a
see you.
challenge.
Can you hear me now?
Yes,
Yes,
we can hear you now.
Chief.
Oh, thank you. You know, one of the problems with the Zoom deals is all the technology, and I apologize for that. Like it says, I am Chief Bill Smith, the chairman of the National Indian Health Board and the Alaska Area Representative, and from the Valdez Native Tribe. Good morning, and thank you for joining us today. As you all know, CMS programs, Medicare, Medicaid, and CHIP provides critical, important resources for the Indian Health Service systems, which has been chronically underfunded for decades. Funding from these programs can provide over half of the budgets for some of the facilities, yet we still experience unique barriers to access to these programs due to the unique nature of the Indian health systems. We appreciate the opportunity to speak with you today about CMS Tribal Consultation Policies, and we're looking forward to a better and more robust policy that helps CMS and the states more closely upheld the United States' unique nation-to-nation relationships with tribes. Well, we appreciate this time with you. We would like to acknowledge for the record that this is only a listening session and that there are no senior CMS officials present. The CMS Tribal Consultation Policy is an incredible, important element of the nations-to-nations relationship that any revisions must be done with the full impact of Indian country and in the dialogue with leadership of the department. Therefore, we request that CMS initiate a formal tribal consultation process that will allow tribal leaders to provide input directly to senior leadership. And does CMS have a timeline and a plan of actions for the review of their tribal Consultation Policies. Awata, thank you.
Thank you, Chairman Smith. We don't have an exact timeline right now. We plan to issue a Dear Tribal Leader letter first to solicit comments. And we do recognize that this is a consultation, but we wanted to take the opportunity to provide an overview of our listening session and to hear feedback such as what you just provided to help us plan the evaluation of our consultation policy better. So what we will plan on doing is issuing a Dear Tribal Leader letter, probably with a 60-day comment period. And then we were also planning on holding an all tribes call. And I think that your suggestion to have CMS leadership on that all tribes call is a very good one. And we will take that back. So.
All right, thank you. I just wanted to restate too that this is a listening session, not a consultation. Because I thought I heard you say that this is a consultation and this is only a listening session. So,
right. This is just.
Thank you.
Yeah, thank you.
Great.
Lewis?
Thank you, Chief Smith, for your important question, and Kitty for the response and letting us all know about the Dear Tribal Leader letter with the 60-day grace or comment period. So greatly appreciated your response. And thank you, Chief Smith, again for kicking us off with the questions. I would now like to invite elected tribal leaders in the audience to ask questions, share their comments, and provide any recommendations to CMS here. If you would like to speak, please put your name into the chat box and the NIHB staff will unmute you and you can ask your questions directly to our speakers. We ask that you please start by sharing your name, title, and tribe. Once you are unmuted, we also invite you to turn on your camera if you would like, so that we can see you as you speak your question. Chris, AC, if you can help navigate that, because I cannot see the chat box. So if you can help with this portion a little bit, I'd be greatly appreciated.
Yep, absolutely. It looks like we have one person with their hand raised. I will allow them to speak.
Hello, can you hear me?
Yes, we can.
Hi, good morning. My name is Buck Ellingson. I'm the health policy analyst for the California Rural Indian Health Board. Thank you for your time this morning. I just wanted to make a statement on behalf of our CEO, Dr. Mark LeBeau. He serves as the California rep on the TTAG. Dr. LeBeau is planning to be here this morning, but he was called away to a funeral of a tribal elder and medicine person. So he sends his regrets. On January 26, 2021, within President Biden's first week in office, he signed a presidential memorandum regarding tribal consultation and the nation-to-nation relationship between tribes and the federal government. This memo sent a clear message that consulting with tribal nations is a top priority for this administration. CRIB requests CMS work with tribes as quickly as possible to establish a tribal consultation policy that adheres to the letter and spirit of the president's memo. Further, we request CMS work with tribes to ensure tribal leaders are informed well in advance about any potential actions CMS takes that are pertinent to Indian country. That's all. Thank you so much.
Thank you very much for those comments. And we are committed to implementing the President's White House memorandum. We are also working closely with the HHS IEA Tribal Affairs Office, who is in the process of revising its department tribal consultation policy. And Ron Allen, who's a member of the STAC, is part of that work as well. And so we will be working with HHS IEA on their policy and to make sure that it's consistent. Our CMS tribal consultation policy is consistent with that policy as well. Thank you.
Thank you. Chris, do we have any other hands raised?
We have one person with their hand raised. I will go ahead and allow them to speak.
Hello.
Hello, Steve, we can hear you.
Yeah, this is Steve Titler. I'm Apache from San Carlos Apache Healthcare Corporation. And thank you for the CMS Tribal Affairs people for being on the line. And for Nick Lewis, Vice Chairman, thank you for your leadership in our NIHB. But I just wanted to talk to the CMS people about the importance, vital importance to tribes for a genuine consultation process. We cannot try to slip in a consultation process into through a listening session. This is what it is only, and we need a real consultation with tribes. That's what tribes in the nation complain about all the time, that we don't have a real government-to-government consultation process with the federal entities. So in this case, I would like to recommend to you all that we have a genuine, real consultation process that will be started with the tribe so that we can have a action session as a result of this listening session. We're not interested in only listening sessions, but we want action as a result of our listening sessions. So that's what I would recommend to the CMS Tribal Affairs people, that we have a real consultation process in the near future, so that we do not let things go on. And I'd like to thank Nick Lewis for his leadership in the NIHB. Nick, thank you for your leadership, and thank you all for listening to my comments. Thank you.
Thank you for sharing your comments with us all here today. Greatly appreciated on behalf of your people. Kitty, do you have any response?
No, thank you, Steve, for those comments. And that's why we don't intend this listening session to be a formal consultation process. I just want to make that clear to everybody. But we really wanted to use this opportunity to start getting feedback, like what we heard from Chief Smith and from you, Steve, that as we go through our tribal consultation evaluation, that we need to consult with tribes directly, and that we need to involve CMS leadership in that process. And so these comments have been very helpful. And, and just in general, to hear how our current policy is working, whether it's working, whether there's things that we can improve. I mean, there will be opportunity for additional comments and input through a formal consultation, but we just, like I said, wanted to kick off our starting to look at our CMS Tribal Consultation Policy by providing an overview of what our policy looks like now, and that we will be going forward with a formal tribal consultation policy in the very near future. Okay, thank you.
Thank you very much. Chris, do we have any other hands raised? I have a comment, but I just want to make sure that we give our participants an opportunity as well.
Oh, we have one hand raised. I will allow that person to speak now, if that's okay.
Yep, thank you very much.
Mhm.
Hey, Jim, you're unmuted. We can't hear you, Jim. Jim, are you there?
Apologize each and everyone for the technical difficulties.
We can try to take another question and circle back to Jim once his audio gets settled.
Okay, is there any other questions? Chris? Or hands
Um,
raised?
There's currently no one with their hand raised at the moment.
Okay, I can talk briefly while hopefully we'll get Jim online, but I'd like to take a moment from the Portland area, the Northwest, to extend our gratitude to you, Kitty, and your team for ensuring that we received another grace period for the CMS 4 walls requirement. Although in the Portland area, we have a state plan amendment that in place to allow Indian healthcare providers to designate as a tribal FQHC, Idaho still is not implemented its state plan amendment. This is an additional extension, or this additional extension is much appreciated to allow us more time to work with Idaho to come to an agreement on the implementation of their tribal FQHC SPA. Is an important element of tribal consultation is the ability for tribes and states to negotiate government to government special terms and conditions related to managed care waivers. These special terms and conditions are then incorporated as part of the CMS approved waivers. However, in Idaho, the state had not been adhering to the special terms and conditions included in their 1915B waiver for behavioral health services from 2017. Because CMS also approves these special terms and conditions as part of the waiver, it should be the responsibility of CMS to enforce those terms and conditions on the state. So we do request that CMS enforce any special terms and conditions agreed between the state and tribes. For example, CMS should be allowed or should be following up on any special terms and conditions that states have agreed to, such as reporting requirements to CMS, standing any technical tribal advisory boards, and so forth. And so I just wanted to make that comment on the 4 walls. And I don't know if you have a response that you can share with us, and then we'll try to go back to Jim, see if we can get his question asked.
Thank you, Chairman Lewis, for those comments on the Idaho 1915B waiver. I know we're working with the state and the Northwest Portland Area Indian Health Board on those issues. Cindy, I don't know if you have any, look like you might have anything to add, but I know that we're still continuing to work through those issues.
Yes, so we are working with the Area Health Board, and the state has submitted a report to us. I'm not sure if it's been released yet to the tribes. We reviewed it, or we're reviewing it. So we are sorry we dropped the ball in terms of making sure they follow all those requirements, but we are working on it now with the state and with the area board. Thank you.
Thanks, Cindy.
Councilman Lewis, you're on mute.
Nick, you're on mute.
Sorry, I just wanted to say that, you know, as with Idaho, I think that that same comment applies to any state in making sure that CMS enforces and supports the trust responsibility that is between the federal government and their tribes. So thank you for your response and looking in to the issue, at least in the Northwest, but I hope that same effort is going in to all the states across the country. Do we have Jim online yet?
Yeah, Nick, I'm here.
Yeah, okay. We can turn it over to you, Jim.
Yeah, thank you. And sorry about the technical difficulties there. I'm not quite sure what happened, and appreciate the link getting sent to me and get me back in the queue here. So thank you, Kitty, and to you and your team for being here. And I just kind of wanted to raise a couple of issues and about the consultation policy and maybe areas where we might make some improvement for both the states and also for tribes. So I think certainly one thing that has been unveiled during the pandemic is the need to create opportunities for consultation under an emergency process. And I'm not quite sure that the process that was followed for the disaster relief SPAs was the right kind of fix where, the state could submit a state plan amendment and then retroactively conduct consultation. So, but I know that, given unique circumstances and needs related to pandemics and public health emergency situations, there has to be something in place that I think is amicable to both the states and the tribes. So I'm hoping that we can improve in that area. I think the consultation policy at Section 8 does a pretty good job of incorporating kind of some of the CMS policy pieces with regard to its role in tribal consultation and kind of conveying those requirements back to the states. But what I don't think it does is it doesn't adopt the principles of the executive order on other issues related to consultation. So what I mean by that is the ARRA provisions discuss kind of amendments to state plans, waivers, demonstrations, et cetera, and the requirements for consultation. And I get that. Those are actually policy precedents that are included in the statute. But what the consultation policy does not do, that, and these issues are equally, if not sometimes more important than kind of the precedents that I just discussed previously, are the impact of eligibility requirements on determinations, policies that reduce payment rates, changes related to payment methodologies or reduce covered services, those items that might impose additional conditions of coverage on reimbursement, like tying requirements back to billing manuals, impose or increase prior authorization or utilization review. So those types of things have, in many instances, a much more drastic effect on the ability of an individual to access Medicaid services or for tribal programs to be reimbursed. And when you look at the executive order on tribal consultation, the policy discusses, it charges all executive departments and agencies with engaging in regular and meaningful and robust consultation with tribal officials in the development of federal policies. And well, the consultation policy, I think, does a good job of incorporating and addressing the things specific to ARRA and some of the other regulatory requirements that are under the purview of CMS. I'm not sure it necessarily addresses the full scope of tribal consultation as was intended under the executive order. And I think that's an important piece that should be incorporated in some form into Section 8, where the CMS is requiring states and tribes to consult in some process. So I think, that's, what I had, all that I had, but I look forward to the dialogue and discussion within the TTAG to work on this. I think there's certainly areas that we can improve it for both the states and also for the tribes. Thank you.
Thank you very much, Jim. Kitty, is there any response that you may have to Jim?
Sure. No, I appreciate those comments, Jim. And I think that as to your last issue about state tribal consultation requirements on billing manuals and things of that sort, we'll have to look at that further. I mean, the statutes doesn't require that, but maybe as we go through our policy, we should look into that more. I think our work with the tribal FQ8C option has kind of spelled that out, that a lot of the services, whether they're FQ8C services or clinic services, are sometimes embedded in policy manuals that are not always available to tribes. So I think that our work in that area has raised that issue. So we can look at that. The other issue that you raised about consultation during an emergency situation, whether it's the COVID-19 PHE or whether it's a hurricane, a tornado, a wildfire, this has kind of been an issue that has been in front of CMS for a while, and not all state tribal consultation plans provide an expedited tribal consultation process. Some do. But for instance, some states have like a 14-day expedited tribal consultation process. That's not going to work if there's a true emergency where states, and in particular with the disaster relief spas, we only allowed states not to waive, just to be clear, we did not allow states to waive tribal consultation. We just allowed them to modify their tribal consultation to a shortened time period prior to submission or consultation after a disaster relief SPA has been submitted under the 1135 Social Security Act authority, and only in instances where the state was increasing services, increasing reimbursements. If they were planning to reduce services or reduce payments, then we would not have allowed them to use this exception, this modification to tribal consultation. But going forward, I think it will be important for CMS to talk to the tribes, and again, talk to the state Medicaid director letters to think about how we can establish an expedited tribal consultation policy ahead of time, and that would require state tribal consultation at the state level as to what an emergency process would look like and under what circumstances, because I think we've learned a lot during the COVID-19 PHE where states really were just scurrying around to increase services, provide more flexibilities, and they were just, a 30-day tribal consultation requirement was just not going to work. So we did make an exception, not a waiver, just allowed the states to modify. But I think we would be very interested in a continual discussion about how we can improve tribal consultation in very serious emergency situations to accommodate everybody's concerns. So thank you.
Thank you for that response, Kitty. And, I think there's instances where expedited consultation is beneficial to the tribal system as well. There might be improvements in the Medicaid program where we might not want to follow the regular timeline. So this cuts both ways, and I get that. Just in closing on the state tribal consultation piece, and I understand that section, relies primarily on applicable law. But I think there's other applicable policy that I would, and that's why I kind of brought up the executive order. I think that in the spirit of the executive order and kind of the process in which this has resulted in all the consultation policies that have been developed by the department and the executive agencies, that, there's got to be something in there that respects the spirit of the executive order as well. And I know those are mentioned as policy precedents at the beginning of each of the consultation policies. But this issue that I bring up about kind of the more administrative policies related to carrying out the Medicaid program are just as important as some of the regulatory requirements associated with the Medicaid program, and has a much kind of drastic impact on the system to be able to get care and be reimbursed for that. So I'm hoping we can somehow weave that into that section in some form. Thank you. I appreciate you guys being here.
Thank you. Yeah.
Thank you again very much, Jim, for your questions, and Kitty for your response. Chris, I know we're getting short on time. Just wanted to see if there's any last questions before we start our wrap up.
There is no one with their hand raised at the moment.
Okay, with that being said, we have come to the end of our time. I wanted to thank our speakers very much for joining us, and all of you who shared your thoughts and comments and questions during this session. I've seen at one point over 160 people on this call, so it's greatly appreciated that you took the time to be with us from across Indian country. I'd also like to thank you, Director Marks, and again, appreciate you for being with us today. We will be following up with you and your team on the issues discussed today. We know that having this time is important, and it is also critically important that we track the progress of these recommendations. We trust that the agency will help support our recommendations, and tribal leaders across Indian country will continue to work to make sure lawmakers know what our priorities are. We do have several other no-cost listening sessions and consultation sessions throughout the week. We'll be holding a listening session with the Assistant Secretary for Substance Abuse and Mental Health Service Administration, SAMHSA, tomorrow at 10:30 Eastern Time. We will also be partnering with the Health Resources Service Administration to host a formal tribal consultation on Friday at 11 a.m. Eastern, and we will hope that you all will join us for those sessions. Also, please remember to stop by our virtual exhibitors hall and marketplace to see the great offerings and connect with our vendors. It is really important to support our tribal artists, and hope that you take the time and go look at what they have. Thank you again to all of our speakers, our audience members. Please take a few seconds at the end of the session to fill out an evaluation. Those are greatly appreciated so that we can do the best job for you and your people. You can find the link that says, please fill out the session evaluation under the session description on the session page in the online conference agenda. This feedback is critical for the work that NIHB does and helps us improve the listening session and consultation sessions in the future. On behalf of the entire National Indian Health Board, I wish you a good week and hope that you enjoy the rest of the conference, and we'll see you again on another meeting. Thank you. Have a good day, everyone.
Thank you very much for having us. Thank you.